Welcome to the WIONPodcast, where we explore fascinating stories and ideas from various fields. In this episode, we uncover how premature grey hair may be more than just a cosmetic concern, and why it could be your body's subtle way of warning you about an often overlooked health problem. Sometimes, the earliest signs of internal imbalance appear not in medical reports, but in the mirror. Grey hair is commonly associated with aging, but when it appears much earlier in life, it may reflect more than genetics. These can severely affect the self-esteem of an individual. Scientific research increasingly suggests that premature graying of hair, PGH, defined in Asians as the appearance of 5 or more white hairs before age 25, can be linked to underlying nutritional deficiencies, and they also trace element imbalances in a person's body. Rather than being merely cosmetic, early graying could signal that essential nutrients are not reaching the hair follicle, potentially affecting broader health. Healthy hair is always seen as a sign of general well-being and youth. Understanding premature graying and nutrient links hair color is determined by pigment-producing cells called melanocytes in the hair follicle. According to a study published in National Library of Medicine, human hair follicles contain 2 types of melanin, eumelanin and pheomelanin. When these cells slow or stop production of melanin, hair starts turning gray. Another study that was published in the Indian Journal of Pediatric Dermatology in 2022 showed that individuals with premature gray hair often reflect very lower levels of key necessary micronutrients compared to those without early graying. Specifically, it talked about deficiencies in copper, zinc, iron, magnesium, and vitamin B12 were significantly more common in young people with premature canities, the technical term for early graying, than in controls of similar age and sex. Copper and zinc are directly involved in melanin synthesis, while iron and magnesium support cellular processes in rapidly dividing hair follicle cells. The mean serum level of B12 in those with premature grey hair was significantly lower than in those without it, according to the IJPD study, and a high proportion of individuals with premature graying were found to have B12 deficiency. The study further recommended that these micronutrients be analyzed in patients with premature canities when testing facilities are available, and that these deficiencies should be corrected through supplementation. Additional research from the NCBI supported these findings. This showed that individuals with premature hair graying reflected not just lower serum iron but also copper and calcium levels than healthy controls, with the severity of graying correlating with the degree of mineral reduction. The authors of this study concluded that the reduced serum levels of all these necessary components were associated with early graying, and that supplementation might be useful for preventing the progression or potentially reverse some graying, although the mechanisms remain unclear and further research is needed. These findings, thus, suggest that PGH may be a visible sign of nutritional imbalance rather than just an unavoidable consequence of aging. If deficiencies such as low vitamin B12, iron, zinc or copper or trace minerals go unchecked, they could severely affect other aspects of health beyond hair pigmentation, including energy metabolism and immune function. Thanks for tuning in to this incredible story. If this episode resonated with you, don't forget to hit the like and subscribe button for more captivating stories to come. Stay tuned.